It's Chris Beyer,
Chris Bowling.
CB. Looking forward to talking to you. You just got back from an industry conference.
Yeah.
Spent a few days learning what's happening in the healthcare and benefits industry, and you had some observations that I know you found fascinating as we're looking into what's really the future of healthcare and some of the innovations that are across the industry. So yeah, talk a little bit about some of those takeaways that you had. I know you had a couple of things you wanted to share.
Yeah, I have two. We'll see if we'll have time for both. So for an employer listening,
That's fair.
Yes, because this can get lengthy, but I'll try to shorten it. I promise. So if you're an employer listening, I think this data is going to be, or this discussion will be important because it'll force you to think about what your plan feels like and what does it cover for each generation that's working for you today.
Yeah, because I mean, we're seeing in some cases still what, four generations in the workforce, maybe three, but sometimes even four.
So
yeah.
The first thing they said that blew my mind is the millennials today are our largest population that's working for employers. And I did not think that would be true. I thought it would be Generation X, which I think is me, right? Yes.
Yeah.
Gen Z is, yeah. And I would have assumed that they weren't old enough, but they are, because I got to remember that 2 out of my 3 kids are millennials, and believe me, are millennials. And so what came out of this is they showed kind of 13 or 15 different ways we access care. It could be primary care, it could be teledoc, and then it broke it down to a percentage of how much of each generation is utilizing that level of care.
Gotcha.
So, as we would assume, baby boomers use hardly any mental health benefit.
Okay.
They are the largest utilizers of specialty care.
Okay.
About that, right? Because as we get older, we're still seeing our primary care, but yet
something else is coming on. Yeah.
Now we're seeing the cardiologist, everyone else. So that was pretty predictable, right? Nothing of an aha moment. Our generation, or my generation, kind of also what I would expect. We do use primary care physicians a lot.
Right.
That's usually when we look at utilization, that's one of our highest.
Yeah.
We use preventative care a lot more than any other generation out there. So, they spent a lot of time talking about the why, and I think, or the so what. Well, the why is we've just been programmed, and it could have been through our parents, but it's more of, our primary care physician focusing so much more on
preventative. Yeah, that makes sense.
So they said, because we see primary care physicians more than any other generation, while we're there, that primary care is saying, Chris, when did you get your colonoscopy?
Yeah.
When's the last time, that we did a blood test and, we checked for, statins, or I should say cholesterol and everything else. The millennials were the ones that I was the most shocked about. They don't use primary care hardly at all. They want their care virtually, or they really don't even care if they have a relationship with a doctor.
The transaction.
That's right. It's a transaction. So they want to walk into an urgent care. They want to, they want everything virtually. And what was interesting of that is what this expert was saying is, because of that, they have more chronic disease than my generation, even though they're younger.
Wow.
Well, the big wow moment was, holy cow. So they're not seeing primary care. Now, by the time they go see somebody, they have a pain, they have an issue, and now they're in a chronic disease state.
Wow.
So I was like, how can a generation younger than me have bigger issues, more costly issues, and they can be 15 years younger than me?
That's crazy. But I think it makes sense because, we've talked about the primary care doctor in good relationship will schedule you back. They will keep on top of you with your regimen of treatments if they notice something. Where if you have a virtual visit or an urgent care, that maybe goes into a report somewhere, it gets ported over, but nobody's looking at that again at all, And I think for our own family, we've had multiple primary care doctors for years. I mean, that we saw when we were young kids that have retired. So then we go find somebody else who was close to retirement, who's retired. We found a good fit, but you get tired of going through that, and you're just over it and just say, you know what, it's easier to just be seen when I need it. I think that might play into it as well. Where you're in that generation that you haven't been able to build a relationship because everyone has been retiring out of that practice. I don't know. That'd be interesting to see.
They find it horribly inconvenient that I have to try to find a doctor.
Yeah.
And now I have to take time out of my day to drive somewhere to see somebody in person, which is such a waste of time. I would rather do that same experience in a fraction of the time compared to you've researched it, you've driven there, now you're in person. So now that meeting takes twice as long. And now I have to leave there. I have to pay while I'm there. I have to drive. And they're like, so, literally it is 90% of a longer commitment to go see your primary care physician. And the millennials just don't have the patience for it.
So it's interesting you started this off with how that would impact an employer. So if you look at different plan designs, making sure that maybe you can get a baby boomer who's still working to consider mental health, but they may not care at all. You could have all of the resources in place. They're not going to care.
They don't care.
Gen X, as you said, they're going to be big on preventative. So make sure you're putting those incentives in, or maybe those reminders, because you're going to get it done. But if you're incentivizing that generation, you may be throwing money out because they're already doing it anyway.
Right.
For the millennials, have the virtual option. Make sure that that's easily accessible. Probably both mental health and primary care through that telemedicine option. That's really interesting because you're going to see different education focus now within the workforce.
Yeah, they went as far to say if you had an on-site clinic, that's how you're going to get a millennial to meet face to face. They want to walk out of their place, go down a hallway, and meet a doc.
Yeah. That's a really good point, Chris. I think we've picked up a lot of that. I think that will change some of our approach to education for our employers.
So they want access to mental health. That is becoming one of their biggest priorities.
Yeah. Gen
Z is right behind millennials. All they want is mental health. Like 100%, I should say that 60% of their utilization since COVID has been mental health driven.
Wow.
So once again, they don't want to see a primary care physician. They're not really on the radar yet for preventative services because they're not old enough. But they're
looking at expanding mental health access with an app or with, more than the EAP. And so often, even, prior to COVID, that wasn't even discussed. So that new workforce coming to you as an employer that's the biggest benefit they're looking for. They want to know about it.
Yeah. So this expert spent time on, if you look at your employed population and your majority millennials, you've got a combination of Gen Z and Gen X, you should be diving deep into how much mental health can I get virtually, because they don't want to see someone in person. So example, they said migraines have been, they're sort of tying that back to COVID. They really don't know, but they've seen a huge spike in migraines. Well, for you to get in to see a doctor that specializes in migraines, they said it's like 8 weeks out. So there was a company there that said, we have a telehealth medicine or option that's just for migraines. And it's a fraction of the cost because they're not taking on, and we'll see you within 12 hours virtually.
Wow. See, I love the technology that's coming back in to help feed the different demographics. I think that's going to be really cool. Well, I know we probably had some more stuff to talk about as we're running out of time. Maybe we'll have another discussion because there's a lot of really interesting data, but then what do we do with it? That I think is the next conversation. So thanks for sharing, CB.
My pleasure. It was awesome. Thank you.
All right. Bye-bye.